Signs of heart failure. What is heart failure? Heart failure is a condition in which the heart muscle fails to pump enough blood to meet the body's needs for blood and oxygen. Although symptoms vary based on which side of the heart is affected. Heart failure typically presents with shortness of breath, excessive fatigue, and bilateral leg swelling. The severity of the heart failure is mainly decided based on ejection fraction and also measured by the severity of symptoms. What are the types of heart failure? Heart failure is classified by which side of the heart is affected. Left-sided heart failure. It is the most common type, occurring when the left ventricle, the main pumping chamber, fails. This causes blood to back up into the lungs, leading to shortness of breath. Right-sided heart failure. It occurs when the right ventricle fails and blood backs up in the body's veins, causing swelling in the abdomen, legs, and feet. Biventricular failure. It affects both sides of the heart. Now let's get to the main topic. The signs of heart failure. Heart failure can have following signs and symptoms. Shortness of breath, also known as dyspnea. Breathlessness during activity, also known as exertional dyspnea. A weakened heart can't increase its output to meet the body's increased demand for oxygen during exercise, thus causing shortness of breath. Breathlessness while at rest. As the condition worsens, fluid can build up even without exertion, making breathing difficult at rest. Waking up at night, this phenomenon is called paroxysmal nocturnal dyspnea. When lying flat for a few hours, fluid from other parts of the body, like the legs, returns to the bloodstream and travels to the lungs. This overwhelms the weakened heart, causing severe breathlessness that wakes a person from sleep. Using pillows for relief, orthopnea. Elevating the upper body with pillows. Uses gravity to keep fluid from accumulating in the lungs, making breathing easier. A person with severe orthopnea may have to sleep sitting upright in a chair. Persistent coughing. Coughing that produces white or pink, blood-tinged mucus is a sign of pulmonary edema, a medical emergency caused by fluid buildup in the lungs. This occurs when a weakened heart cannot pump blood efficiently, causing it to back up into the blood vessels of the lungs. Edema of body. In heart failure, the swelling, edema, and related weight gain happen because the weakened heart cannot pump blood efficiently, causing fluid to back up into the body's tissues. The location of the swelling depends on which side of the heart is most affected. The location of the fluid buildup, also known as congestion, varies depending on which side of the heart is struggling. Right-sided heart failure. This occurs when the right ventricle, which pumps blood to the lungs, is weakened. Blood backs up into the veins that drain the body, causing fluid to collect in the lower extremities due to gravity. Swelling of areas. Feet, ankles, and legs are most commonly affected. But swelling can also occur in the abdomen. This is known as ascites. Weight gain. The accumulation of this extra fluid can lead to sudden weight gain. Left-sided heart failure. This affects the left ventricle, which is responsible for pumping oxygenated blood to the rest of the body. Blood backs up in the vessels connected to the lungs. Swelling of areas. This causes fluid to build up in the lungs, known as pulmonary edema, leading to symptoms like shortness of breath and coughing. Weight gain. Weight gain is still a common symptom, due to the overall fluid retention in the body. Why weight monitoring is important in heart failure patients. For a person with heart failure, monitoring weight is one of the easiest ways to detect worsening fluid retention. How much to watch for? Rapid weight gain, such as more than 2 to 3 pounds in a day, or 5 pounds in a week, can be a sign that heart failure is progressing. What to do? It is crucial for patients to monitor their weight regularly and report any sudden changes to a doctor, as early treatment can help prevent the need for a hospital stay. Tiredness or fatigue. The tired feeling and weakness during everyday activities caused by heart failure are due to the heart's reduced pumping ability and the body's response to it. When the heart cannot pump enough blood to meet the body's needs, vital organs like the brain receive priority blood flow. This leaves less oxygen-rich blood for muscles and other tissues, causing fatigue, nausea and lack of appetite. In heart failure, a feeling of being full or sick to your stomach is caused by fluid buildup and reduced blood flow to the digestive organs. This causes congestion in the liver and intestines, which interferes with digestion and can make you feel nauseated or full even after eating very little. This symptom may indicate that your heart failure is worsening. Mental confusion. Memory loss and disorientation in heart failure are symptoms of cognitive impairment caused by reduced blood flow and oxygen to the brain. Caregivers or relatives often notice these changes first, which can range from subtle to severe, including symptoms of delirium or dementia. Increased heart rate, also known as tachycardia. In heart failure, palpitations feel like your heart is racing, throbbing, or pounding to compensate for its reduced pumping ability. This sensation, which may also be described as fluttering or skipping beats, can also be a sign of an irregular heart rhythm, also called arrhythmia, which is a common complication of heart failure.